Good morning. Today we are speaking with UMHS graduate Dr. Andrea Cuviello, a pediatric palliative oncologist and assistant professor at Phoenix Children's Hospital in Arizona. I want to welcome you today, Dr. Cuviello, and we're so glad that we're getting a chance to speak with you. Could you just tell us briefly about where you are currently working and what someone in your specialty does to help patients?
Yeah, of course. So, like you said, I'm currently an assistant clinical professor and staff physician at Phoenix Children's. I am primarily part of the palliative care division, and I work very closely with our pediatric oncology team to help support patients and families with cancer. So, I'm also developing a research side to our division, which is part of the new vision for Phoenix Children's as an institution. As far as what palliative care is, so I kind of give it a blanket description of being an extra layer of support and an advocate for our patients and families. Most commonly, I would say people sort of hear palliative care and they think of it being end of life or hospice related, which is true. And I kind of describe that as sort of a branch on the tree of all of the things that I do. So more often, I'm actually helping with symptom management. I do a lot of work around communication, and that's really just helping to make sure our patients and families are getting the information that they need in a way that they prefer. And then the last bit that I do is really focused around goals of care. And when I say that, I really just mean getting to know patients and families and helping them keep what's most important for them and their child at the forefront of all of their medical decisions.
Okay, great. And you are about to speak at the upcoming UMHS White Ceremony in January 2024. And do you have any message that you wish to share with the incoming class?
Yeah, I'm so excited to have been offered this prestigious opportunity to speak for the incoming class. I don't want to give away too much right now, and honestly, I'm still kind of crafting exactly what I want to say. But overall, I'm hoping to leave a message that is just both inspiring and encouraging. You know, this incoming class, their journeys as physicians are just beginning, and it can be a long and arduous road. So I've found what has served me best is really just following your intuition, and the success in your dream career will kind of follow that. And no one achieves anything alone. So lean on friends, find mentors, and more importantly, sponsors who want to help you succeed.
Okay, great. And I think that's sound advice. And Dr. Cuviello, you also worked at the famous St. Jude's Children's Research Hospital. Can you tell us a little briefly about what that experience was like?
Sure. St. Jude is truly a unique place with incredible opportunity. I was lucky enough to have my palliative care fellowship in part be sponsored by St. Jude, and was really drawn to the institution based on my interests in global health. So during my time there in my first attending position, I found great support in sort of weaving together my love of pediatric oncology and palliative care and establishing an academic foundation. And my time there led to several additional training opportunities and scholarships that have not only served me clinically, but have also allowed me to grow as an expert in my field. Perhaps the most coolest part of my St. Jude experience were the opportunities to teach palliative medicine to international clinicians. I can now say that I have several colleagues and friends around the globe who are dedicated to the cause of improving palliative care access to pediatric patients and families. And I still continue to partner with my colleagues at St. Jude today, dabbling in some research endeavors and continuing to teach on both a national and international stage.
Okay, great. And what advice do you have for current and prospective students that are thinking about maybe going into pediatric palliative oncology?
Yeah, that's a great question. I would say, first and foremost, take care of yourself. It's a difficult career path, both emotionally, physically, and mentally. And often the institutions don't really protect work-life balance. So I think the onus becomes on you as an individual to find people who will, or who can teach you how to assert good boundaries. And I think apart from the self-care and sort of healthy work-life boundaries, finding people in your field who will act as mentors and, more importantly, as sponsors. It's so important to have people who will give you credit for your work when you're not even in the room to hear it, or who will think about you when they hear about a new opportunity and think, oh, wow, this might really help this person's career grow and develop. So sponsors, I would say, are kind of hard to find, but they can become incredible colleagues and friends in your professional life.
All right, great. And let's switch gears a little bit. And can you tell me a little bit about why you chose UMHS over other med schools?
Yeah. I think honestly, at the time for me, it was the tuition that was kind of an appealing factor. I kind of figured, anyone can learn the book science part of medicine really from anywhere. And when it came down to the clinical education aspect of this medical training, I felt like UMHS really had a good infrastructure in place to allow me to receive on par training with US medical students. And even, and on some level, promote unique opportunities like working in different hospital systems and networking across the country, which you don't really get or see too often in the US medical system.
Right, and that's so true. And is there anything else, Dr. Cuviello, that you would like to add about either pediatric palliative oncology or UMHS that you think that current and prospective students should know?
Yeah, I suppose I would say that choosing a career in medicine is entirely a giant leap of faith. So lean in, it will feel uncomfortable, you will feel lost at times, but trust the process, remember your why, and you will come through the other side in exactly the right place you're supposed to be.